Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain that you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma therapy to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Today's program could open up a new life without pain for you. To speak with Dr. Darrow, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Now, here's Dr. Darrow with his co-host, Nita Valens.
Well, hi there, Dr. Darrow.
Nita Valens, what's happening today, you beautiful woman?
Why, thank you, you handsome guy. Listen, how are you?
I'm living it up, of course.
Okay, excellent. So how are we going to help our listeners live it up?
Well, I'm looking through my book right this second. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And it's got 250-some studies on why surgery may be not a good option for you with orthopedic issues, and why regenerative medicine may be a very excellent option. I'm actually looking right this second. I'm flashing through page 67. I'm showing it to the camera right now. It shows a spinal fusion with metal. And the first time I was in one of these surgeries, I really couldn't believe it. It was during medical school, that such big appliances were put into people's backs. And then I did a study on back fusions and the failure rates. And it's pretty astounding. Back then I didn't know about regenerative medicine, and I loved orthopedic surgery. That was my path at the time, until I had a shoulder surgery in my fourth year of medical school, and it literally ruined my shoulder. My shoulder hurt before the surgery, but all that was done was called a decompression. My boss just cut some ligaments and shaved down the acromion, which is the top bone on the shoulder. And I woke up with a fever, and God, these pictures in this book are amazing. By the way, anyone who calls in now, I'm going to give the phone number to the studio. It's 866-870-5752. Write that down and give us a call right now. 866-870-5752. And we'll talk to you live about your issues with orthopedics, your pain in your body, and anything from the head to the toes, meniscal tears in the knees, rotator cuff tears in the shoulders, herniated discs in the back, and everything else you can think of. But anyway, getting back to my story, I had my shoulder operated, and I was very excited. Woke up, and my shoulder was much worse. It was all swollen, and I couldn't move it. And I had a fever. And I didn't know how to fix it. I didn't know what to do after that surgery. My surgeon didn't know what to do. He apologized. It wasn't his fault. It's just what happens sometimes in surgery. And fortunately, while I was at UCLA in my residency, a doctor came in to discuss prolotherapy, PROLO therapy, which is proliferative therapy. And that therapy was something that saved my shoulder, because I learned how to do it to my own body, and injected my wrist and healed it. I also had a wrist injury from golf, and the shoulder injury was from weightlifting, doing deep bench presses to thicken up my lateral pectoralis muscles. And anyway, I learned about this from this gentleman, this doctor, and he took me to a conference, and they injected my wrist, and it was about 50% better the day after. Then I injected it myself a couple more times, 100% better. I don't remember when the last time was I injected my wrist. It's got to be 20 or 25 years ago. And shoulder, I've had 3 injuries to it. The first one healed with overnight with 1 injection. And, well, actually it was more injections, but 1 treatment. And I injured it again. I think it was 12 years later. That took 2 treatments. And then I injured it again several years after that. My right shoulder is my action joint because I'm right-handed, and I do tons of sports. I was a gymnast when I was young, and I hit hard. Even though I'm not a giant guy, I'm only like 6 feet, 170 pounds. I really enjoy speed, and that shoulder has taken the brunt of most of it. I have injected from time to time my knees and my elbows. I did years ago. I haven't had to do that again. The wrist was years and years ago. The shoulder years ago. Neck and back many years ago. So my most recent injury was my knees, sprinting up the mountains where I live with my 2 huskies pulling me, and they're fine now too. I'm active again, and I'm very fortunate to have learned about regenerative medicine, which has morphed from the old days of prolotherapy, which is injection basically with dextrose and lidocaine or sodium moreuate or zinc sulfate. Some guys still do a bunch of it. There's a guy in Florida named Ross Hauser who's the old master of it. He was trained by the ancient masters, you might say, from the 1900s, Gus Hemwall and George Hackett in Chicago, where he went to medical school. And Ross is a great guy, a good friend of mine. Anyway, he likes prolotherapy. I like platelets and stem cells. I think they're much more effective. When I hurt my knees, I used prolotherapy because it's a little bit easier. I just grab a bottle of dextrose and a bottle of lidocaine and inject. I don't need any help from my staff. And I did I'm trying to remember which knee it was. I don't remember. It's so long ago. I did my knee about 10 times with dextrose, and it would work each time. But then when I'd go sprinting again, the knee would loosen up again. And, I know what it was. My left knee, the patella was loose. I was hit by my dog Dakota, my husky. That's right, when that happened. And the patella came loose. So my leg would get stuck. My knee, trying to bend it, would get stuck. So I injected her all the way around the patella, and it would tighten up with prolotherapy. And then a short while after, while running, it would loosen up again. So I then did one PRP treatment, platelet-rich plasma, which is a blood draw, spinning the blood in a centrifuge, and then taking the platelets and injecting them. And that really tightened it up. And then to perfect it, I added some stem cells to it myself. So I love these treatments. It's worked on my body, and it's worked literally every time I've done it. Most of the time I heal overnight, but most patients, I can't say that happens for them. Sometimes it takes a few treatments. So give me a call. The phone number of the studio right now is 866-870-5752. If you call, I'm going to send you a free copy of my book. It's about 200 pages on the medicine of stem cells and platelets, regenerative medicine it's called, because we regenerate the body. We don't cut things out, and it's very simple. You walk in the office, you get your injections, and you walk out. You don't need someone to drive you. You don't need anesthesia. And some doctors do this in a surgical center in the hospital. I think that's kind of overkill. It's very expensive to do that, and there's no reason to do it. We do these all day long. Dr. Grove is my injector now, and he is extremely proficient. He uses an ultrasound for almost every injection he does, and he's very, very well trained. I think he's probably one of the most well-trained injectors on the planet. And he's a buff athlete himself. He was captain of the Cornhuskers football team when he was back in college, and spent many, many years training athletes, and then went to med school and then fellowship in sports medicine. So he is very, very well qualified. My patients love him, and he's just a doll. He's a great guy. So, Nita, I forgot to mention that we do the vampire facelift in the office, which is really cool. It can make people look better, and it's very simple. It's just injecting the platelets of a person into their face or using stem cells, and it regrows the collagen in the face. Really all we're doing is regrowing collagen. Collagen is the structural protein of the body, and these treatments sequester fibroblasts, which are cells that grow tissue. And also, when you get into the platelets and the stem cells, it's more advanced than just that, but you get that effect also.
And may I just suggest that we talk to Joe?
Yeah, we don't want to keep Joe waiting too long. Joe, Dr. Marc Darrow, you're in Rancho Cucamonga. It's hard to say. So your shoulder bothers you. It says you have a rotator cuff tear going on here. My call screen, I wrote that down. How long has your shoulder bothered you, and which shoulder is it?
It's the left shoulder.
Okay. Are you right-handed or left-handed?
I'm right-handed.
Okay. And how long has it bothered you for?
It had a slight tear over a few years. I used to lift really heavy weights and shoulder presses and all of that. Played baseball and all of that over the years. It took its toll, and so now it has a full tear, and it bothered me. I mean, it took a turn for the worse about a year and a half ago. So, and now it's about. I've worked on it, and my doctor's recommending surgery, but I really don't want to do that.
Okay. Do you have any range of motion? Can you lift your arm up?
Yeah.
I've
improved it with exercise and supplements and stuff like that. Good.
Yeah. So you have range of motion, you have some pain, and now to me, in my world, which is a different world than the surgeon's world, so I'm just putting that out there, we think differently pretty much. They think that a tear means you need surgery because you have some pain, and I think you can heal the pain by doing some regenerative medicine injections with either platelets or stem cells, depending what we want to do. And that's a choice of the patient, not me. And the reason I say that is because my right shoulder has 3 tears in it. I have a subscapularis tendon tear, I have a supraspinatus tendon tear, and a labral tear. And none of those bother me. They did bother me, but I self-injected and healed up whatever the problem was. Now you're thinking, and people listening are thinking, well, you still have a tear, so how could you be fine? I can play golf, I can throw a ball, I can do whatever I want to do, I can lift weights. So what's the issue? We confuse the pathology, which is what you see on an image, with the reality. So that's pathology versus reality. I just made that up this second, so I'm writing that down. I mean, I've been talking about the concept for over 25 years of doing this work, but I just really thought I like these terms. And the pathology is what you see on an image or what a doctor thinks it is in his diagnosis. And I'm just going to say it the way I see it. Doctors are usually wrong. I'm not putting them down.
Yeah, exactly. I mean, not everybody most people look at doctors as gods, but they make mistakes just like everybody else, and they have they have an agenda with the hospital or whatever, So
well, it's the culture that we grew up in that we often follow, and I grew up in the culture of surgery, and I loved it. I just absolutely loved it. It was the most fun of any kind of medicine I'd ever done. But when I had my shoulder surgery, I learned it's not the best way to do things for everybody. I'm not saying not to do it, and I'm not saying I don't like surgeons. I love surgeons. They have the brunt of all of this on their shoulders, and it can be very dangerous. People die in surgery, and you think, well, how could you die in a simple surgery on a shoulder? I've seen it happen. I've seen it happen a couple times, and it's very shocking. It can be from the anesthesia. It can just be from fluid overload, whatever it is that happens during surgery. It could be a lot of things, allergies to medicines. So it's not common, but if you're the one that it happens to, or you have a bad outcome and you're the one, that's 100% for you. So I'm hoping never to get a surgery again. After that failed shoulder surgery of mine, I've never had an orthopedic surgery. I've had others for medical issues. I had a pheochromocytoma, a tumor on my adrenal gland, and it got very large. It was 4 centimeters, and I had that taken out because I had high catecholamines. I was jacked up all the time, and people die from that tumor. So I had that taken out. I'm trying to think whatever. I mean, I've had tonsillectomy. I had an accident, a car accident. I had surgery on my face 4 times to put it back together. So those kind of surgeries I'm all for. I'm not for orthopedic surgeries.
Those are necessary. I mean, absolutely necessary.
Yeah.
The ones you
and listen, a lot of orthopedic surgeries are necessary. If you have a broken bone, you need a surgery most likely. But the surgeries that are done, all these meniscal tears all day long, not needed. And the studies show that. There's study after study showing that the surgeries can make you come out worse, and that regenerative medicine using platelets or stem cells can help you heal up. So why do something invasive when you can do something conservative, like get a couple of injections to help you heal up?
Exactly.
Now, I've had many people with full rotator cuff tears who we've healed up. So did the tears heal up? No.
Mine is like a full rotator cuff.
Yeah, but full or partial doesn't mean anything to me.
Okay.
And I've had people that couldn't even lift up their arms because their tear was so complete that it completely healed up. I'm not saying this is going to...
I don't mean to interrupt you, but I've improved the range of motion, but I do want, I'm an active person, and I don't want limitations, and it's like, so that's, I've been listening to your show and over the last few months, and you were referred by a friend, and I've just, decided to call in today. But,
Well, I appreciate that. And we're going to send you a free copy of Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's got the foreword to the book by Suzanne Sommer. Do you know Suzanne Summers, the actress?
Yeah.
Yeah, she passed away recently.
Yeah, she recently passed away, yeah.
Yeah, what a testament to life she was. What an amazing friend and person. And I was fortunate enough to have treated her and her family, her son Bruce, and her grandkids and their friends.
Oh, wow. She aged well, too, I have to say.
Well, she's written so many books. One of them is called Ageless.
Well, she was. She stayed pretty attractive throughout the years, yep.
She was attractive to the last second. She also wrote a book called A New Way to Age. And I'm looking at it right now. On page 302, there's a 19-page chapter about me in it. And about my work.
Oh, really?
Yeah, how it worked for her.
Wow.
And
wow. Okay.
So she's a great advocate for all medicine, traditional and what's called alternative. But obviously she liked conservative things like we all do. Mm-hmm. Well, I can't say like we all do, because I have a lot of patients who come in who just want surgery. And they come to see me for second opinion.
It's an easy fix, but like you said, it doesn't always turn out well.
I'm gonna tell you this, Joe. If it was an easy fix, I would be doing it.
Right.
Because I loved it, but I found that it was not an easy fix. It was a hard fix, and it was just sometimes the beginning of people's miseries. I can't tell you probably the thousands of people over the last 25 plus years I've been doing this that have come in after a failed surgery, crying, sitting there, going, "Why didn't the surgeon tell me this could happen to me?" Yeah. And
that's what I've heard, and it's not 100%. And the doctor that recommended surgery informed me of the same. He said, nothing's guaranteed.
Well, that's good. He's an honest guy. A lot of surgeons do not tell people that. Yeah. They'll have them sign a consent that the patient never reads because the consent forms have small fonts and it's long. And I'll be honest, when I go see a doctor, I don't read the consent form. I just sign it. It's like I know I have to sign it to get treatment or see the guy, so I'm just going to sign it.
You'll scan over it, but you won't really sit down and take the time to read that. Who has the time right then and there,
Yeah, and I'm a lawyer. Typically with a contract, I read every word. But when it comes to medicine, I know that there's nothing I can do. Now, my consent form is in a big font, and I make people not only read it, but they have to write in their own handwriting certain things like there are no guarantees. And it may take more than one treatment, things like that people get confused.
What's your success rate on this?
It's hard to say because after a person comes in, they don't always come back. Sometimes they're healed. So we don't get to follow up on every single person. I would say off the top of my head, it's probably about 80-90%. Okay. Now that's if people follow 80, directions.
90%. Wow.
That's if people. Well, we have to choose the right people. We don't do stem cells and platelets and everybody that walks in the door. There are some people that it's. I don't think it's a good treatment for. So it's a select population.
How many treatments does it usually take?
Anywhere from 1 to 3 typically, but it could be more. And a lot of this depends on the patient. A lot of patients don't listen to me. You know, they're going to be active after we inject. You can't be active in that area because we're growing tissue. We're stimulating tissue to grow. So if you go beat it up right after treatment, we like people to chill for a couple weeks and let the tissue grow in. There's something called granulation tissue, which if you look under a microscope, you can see it growing. And there's been studies on regenerative medicine years ago. In my first book, Prolotherapy, Living Pain-Free, which was a long time ago, I actually have photomicrographs of the tissue growing in. That's the biggest issue is patients being too active. Yeah. I just had a patient come in who is a TV reality star, came in yesterday, and she was going to go to a show. She was going to fly, and she didn't get treatment. And there was another one that came in. I'm trying to think. Oh, a couple drove down from Fresno, and she had I think 3 different areas to take care of, and she was going to be traveling to Texas to see, I think, her grandson or something in college, and was going to be doing a lot of walking. And I said, you better wait till you get back, because even though the treatment would help, it's going to stimulate tissue growth. You're not going to feel better, and then you're going to think it's not working.
Where was her issue at in her body?
She had meniscal tears and arthritis in her knees. And then I forget what the other issue was in her shoulder.
Wow. Another question I have is that, insurance doesn't, I brought these alternative, treatments to my doctor, and, insurance doesn't even cover these.
Some insurance does. Some insurance does. Okay. Yeah.
Okay.
Yeah. If it's, let's say it's an accident, like a personal injury accident. Oftentimes your med payments policy will cover that. Sometimes workers' comp insurance will cover it. A lot of companies have medical savings plans that patients can use for that. General health insurance typically does not cover it. So that's what you're referring to, yes.
Yeah. Okay.
But, the question patients have is, well, why should I do your work when I can get a surgery for free? And there's no free surgery.
You just stated that earlier. You just stated why earlier, because it's not 100%, and
it's not just that, but sometimes
it could be worse. It could go worse.
And it can cost you a lot of money. You can lose your job. Yeah. I mean, you're not supposed to, but these things happen. You can lose your profession.
Wow.
You can have to hire people to take care of you for a certain period of time or for life. I mean, I've seen the worst things happen. That's all I'm going to tell you. I'm not putting down surgeons. I love surgeons.
No. Yeah.
I love them.
They serve a purpose, yeah.
Well, yeah, and that takes a lot of guts to do surgery. It takes a lot of guts to take that responsibility on your shoulder.
For sure. Yeah. Thank you for taking the time to speak with me today. And
Joe, I'd love to. The thing is, I was just going to say, I'd love to touch your shoulder, because in less than a minute, by just touch, is how I find out where the pain's being generated from. So people say, why don't you want my MRI or my X-ray or my CT scan? I go, well, I do want it, but it's not really how I diagnose.
Okay.
And I'm going to be honest, there have been some images I've gotten for musculoskeletal things where I found cancer or a bleb in the lung or something like that. Joe, if you want to hang with us, we're going to go to a short break. And the phone number to call into the studio is 866-870-5752. And if you want to call my office and get more information from my staff, number to the office is 800-300-9300. Website, www.jointrehab.com. You can watch me doing videos of these procedures.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Joint Rehab and Sports Medical Center in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.